It's a time of the show where we like to separate fact from fiction, and we are joined by epidemiologist, a disease detective, Cherise Rohr-Allegrini with the San Antonio AIDS Foundation, and many other things going on. Thank you for joining us, Cherise. And right off the top, I want to talk about where we are right now, and is there a way to predict how long this surge is going to go on? I know there are some people who are saying, well, with at least some number of people vaccinated and people having already got COVID, that hope that this surge will not be as long as surges we've seen in the past. Do you agree with that? Or is there any way to know?
I'm hopeful that it won't go on as long because we have fewer people that are susceptible, because we've had so many people vaccinated, that I'm hoping this surge isn't going to go on for months like we saw before. However, we're seeing more children being infected, and children under 12 are not vaccinated. So are we going to see a long surge in kids? Possibly. And that's actually what's really scary. I do think that in adults, we're going to see the rate start to drop. I just don't want to see it increase in kids. And I'm a little nervous about that.
And, you know, I still continue to hear people making comparisons to the flu, saying that COVID-19 is like the flu. People die of the flu every year. Children die of the flu every single year. And so I want to get your take on this assessment to see if it is accurate, that most of us have spent our entire lives being exposed to the flu, so our immune systems, they have experience with the flu. We also have the ability to vaccinate kids, babies, 6 months and older from the flu. That's much different than where we are right now in this pandemic. So is the reason we need to get more people vaccinated to give us that baseline protection that would prevent severe illness, prevent death, but also to protect these kids who cannot have that protection that's available to anyone over 12 at this point?
Right. You just gave an excellent example of how the flu works. Most people have experienced the flu in some form or another over the course of their lifetime. So most people have some immunity to some strains of the flu, and we have a vaccine available starting at 6 months. That's not the case for COVID. Until a year and a half ago, nobody in the world had seen COVID before, which means there's absolutely no immunity. So we have a lot of catching up to do. And really the only way to do it is to get vaccinated right now. Flu mutates differently. It's a very different kind of virus than what we have for SARS-CoV-2. So making the comparisons is a little bit difficult, other than the illness is a little bit similar. But COVID is much worse. Every year we have about 200 children die of flu. So far, we've had over 400 children die of COVID. That's a huge number, especially given that we don't have immunity in kids.
Are you concerned that when we talk about mutations and the Delta variant and people talking about the Lambda variant and all these other things, that the more that this thing mutates and comes up with different variants, that eventually we're going to get to a place where the vaccine that we have right now isn't going to be effective against one of those variants?
Well, no, I'm not actually worried about that. Despite all the variants, that's a normal process of evolution. Viruses evolve, viruses mutate. Most of those mutations don't really have any effect. Occasionally, a mutation will escape and be more significant. But the way we control that is we get vaccinated to most of the population, so the virus can't be spreading. It doesn't have a chance to mutate because it's not replicating so much, because it's not being transmitted from person to person. So while the vaccine doesn't get rid of the virus completely, it can bring it down to low enough levels that we don't see this rapid evolution and we end up with escaped mutants.
I know that earlier in this pandemic, we focused a lot on a 2-week timeline, seeing what happens 2 weeks out from a big event, whether it's, a holiday, for example. Mm-hmm. The big event right now is back to school. So, and that's, a huge concern for a lot of parents with this Delta variant. What are you expecting that we will see as so many kids are back in classrooms in the coming weeks?
Well, let me start off by saying I hope I'm wrong. I will like nothing better than to be wrong, but I expect that we're going to see a surge in cases in children, particularly under 12, and in teenagers that are not vaccinated, because we're putting a large number of people together in close quarters without mitigation efforts. You know, in my kids' school, they're wearing masks religiously, and I'm hopeful that that's going to make a difference. But in many schools, they're not. In many schools, there's no protection. So I do expect to see an increase in the number of cases over the next few weeks. Incubation period for Delta is shorter, so we start to see cases sooner. I'm hopeful that we'll be able to keep it under control, but the way to do that is to try to mitigate the spread in schools. What's
your advice to parents that are out there? I mean, you're a parent of an 11-year-old, I know.
Right.
Obviously, Myra has younger children. I mean, I'm at a place where my kids have all been vaccinated. So what is your advice to parents out there that are concerned, that are stressed by all this that's going on?
Vaccinate everybody who can be vaccinated, because you form a sort of safe cocoon around the child who can't be vaccinated. So you're less likely to bring the virus home to the child that can't be vaccinated. Have your child wear a mask, have them wear it properly over their nose in school. And most kids are fine with that. Most kids, if their parents tell them to do it and they're used to doing it, they have fun with it. Get them cool, funky masks with funny names and funny characters that make them happy. And talk to your schools. Insist that there be mask wearing. Talk to the teachers and the faculty and everybody that you can, other parents, about vaccinating everybody over 12, because all of those things will help protect those kids under 12, as well as everybody else that's potentially exposed to the virus.
Sometimes I have to remind my 4-year-old to take it off. He's quite content in the mask.
Exactly.
I find it interesting that we've got people still refusing the vaccine, but then we also have a great number of people who are clamoring for a third dose. They want that booster shot. And it seems that we have to lessen the gap between the two. Is that the only way that this pandemic is going to end?
It really is. We have to just get more people vaccinated. I'm excited about the third dose. It clearly seems necessary for people who are immunocompromised. But really what we need to focus on is getting more people protected, which means really addressing the hesitancy that folks have, answering their questions, and making it easier for everybody to get vaccinated by bringing the vaccine to them.
You work with the San Antonio AIDS Foundation. I want to put up I think we have a graphic right now with what's happening on Friday, the chance to be vaccinated. It's sponsored by SAAF, Pfizer, and Johnson & Johnson, available 9 to 3:30, 818 East Grayson Street in the cafeteria area. Talk about the LGBTQ plus community. Are you seeing high rates of vaccination? Do you have a sense of the vaccination rate in that particular part of our community?
You know, in the LGBTQ plus community, I'm not sure. I know that in general, that population is hesitant to seek medical care, often because of discrimination. So there's a lot of anxiety just seeking medical care. I haven't heard necessarily vaccine hesitancy in that population, but like any group, they want to go where they feel safe, where they feel comfortable. And so we want to make sure that we're making the vaccine available in all places, and in a place like ours is very comfortable to the LGBT community. Our event is open to the public. Anybody is welcome to come, and we're really grateful to San Antonio Metro Health. They'll be the ones that are actually giving the vaccine.
Where actually is this? Is this a particular building that we're talking about here?
Yeah, so it's the San Antonio AIDS Foundation offices in Government Hill. Our offices have a little cafeteria off to the side, but you'll see it when you come up. We're going to have entertainment outside. We have signs outside. We'll be serving lunch. To anybody that comes in, we'll give you a Fiesta medal for anyone that comes in. But yeah, it's the San Antonio AIDS Foundation offices on Grayson Street, just up the road from the Pearl, a couple blocks away from the Pearl.
Great.
Just another way you can go get that vaccination. So easy, so many opportunities within our community, and I want to keep driving people to our website. I know that's where you can find plenty of opportunities in your own parts of town to get the vaccine. Cherise Rohr-Allegrini, always a pleasure having you here.
Thank you so much for having me.
Thank you, Cherise. We'll be right back.